I'm Dr. David Dow, and today I want to answer an important question. There are three things that I think that your chiropractor should be doing for their patients. And the first one I want to mention is so important to me, and it's so obvious, and I see this happening less and less and less all the time, but they should be taking x-rays. When you take an x-ray, that allows you to really see what's going on in the body, really see where the problem is, allows you to see if the spine is degenerating, if the neck or low back are degenerating, how bad the degeneration is. It allows me to see how you're going to heal, fast or slow. And we like to do a special type of x-ray called a motion study. So we have you bend forward and bend back, and that actually allows us to see which bones are moving and which ones are stuck. And it shows us exactly what we have to do to get the problem corrected. It also identifies the problem. So we look for issues that are called subluxations. It's when a bone shifts out of place and it puts pressure on the nerves. The only way I know that you can really see that well is on the x-ray. And by doing that motion study, having the person bend forward and back allows you to see those clear as a bell. After treatment, your chiropractor should also be doing post x-rays. So how many people, maybe you, have been to the chiropractor before and had x-rays, but did that chiropractor take a post x-ray after your initial x-ray to show that they got the changes that they were looking for, to show that you got better and that those subluxations were corrected? So we take post x-rays after our initial treatment so that we can see that we got the results that we're looking for. And I find that to be so critically important. Another thing that your chiropractor should be doing is when you do that initial consultation is they should be listening to you. You want a chiropractor that's listening to every part of what's going on, doing a really thorough history, and that shouldn't be just a real quick, short thing. We want to get and we want to find the cause of the problem. We want to set goals for you. We want to see what it is that this problem, how it's affecting your life. Is it affecting your work? Is it affecting your home life? And exactly how. And if we got that corrected for you, what would that do? What would that allow you to accomplish? What things are you not doing now because of your back pain that you wish you were able to get back to doing? And we want to hit every one of those goals and get those things corrected. And that's a critically important thing to be able to do. The third thing that your chiropractor should be doing, and I feel like this is really important too, is learning all the time. So I'm always taking new training and learning new techniques. I'm out there searching for chiropractic gems, I would say, chiropractic gold, little techniques here and there that are the best thing that we can use to correct problems, the safest procedures that get you the results that you're really looking for. One of the ones that I've discovered is this Thompson upper cervical adjustment. It's called an occipital lift. My favorite adjustment, bar none. Most of the chiropractic miracles that we've heard of in the past that were so amazing and made so many changes were because of that adjustment. The Thompson low back adjustment is such a really great, really safe way to work on disc problems and things. We use a device called the 𝑖rthroStim. But I'm always taking new training and learning new techniques and different things that can be helpful. At least a lot of doctors in our area are following some techniques that haven't really changed in the last 50, even 60 years. And they're great techniques, but there's so much new stuff out there. And if you want to see what more can be done for your health problems, I would recommend that you come in. We do our evaluation, do our consultation, take those motion study x-rays that I talked about, and then what I'll do is I'll create a plan for you to get that corrected. And there is no obligation for you to do any further care. You always have the option to say no to my recommendations, but we want to get those problems fixed. And the reason why we have over 100 5-star reviews now is because of how well we take care of our patients. We know that when you come into our office, you're the boss. You pay our paycheck. Every person who works in our office knows that our paycheck comes from you. And it's not me paying their paycheck, it's you doing that. And we know that we want to give as much love as we can and help all the patients that we can, and that's our direct focus. So if you like what we're saying here, go to our DellChiropractic.com webpage, click on the YouTube channel, go to the YouTube channel, subscribe to it, and there's so many great videos on there about so many different health conditions. We're doing stem cell injections for knees and hips and shoulders, and we're treating so much neck and low back and maybe different problems on there. But what we do in our office to correct those problems is on those videos. And make sure you subscribe to that. Comment below if you've got any questions. We love questions. And keep watching us and come and visit us really soon. Can't wait to see you.